I leave the stage for the next speaker, which is Undine Knarvik from Norway. She's going to present the implementation of telemedicine in wound care in Norway. Please, Undine.
Thank you very much for being invited. Yes, I will talk about implementation of telemedicine in wound care in Norway. I'm from the Norwegian Center for Integrated Care and Telemedicine. And I shortly will talk about our organization, introduce it. Afterwards, I will talk about the web-based wound record and some results and experiences we have with it. I will not say so much about the healthcare challenges. The speakers before me had talked about this before. The demographics are a challenge and the lack of qualified health personnel. What I can add is that regarding the last one, in Norway, every fourth student must choose the health sector in 2025 for us to have enough health personnel. Developing and implementing welfare technology for the citizens is highly important, and the NST, it's the abbreviation for our organization, Norwegian Center for Integrated Care and Telemedicine, does this, focusing on people with chronic diseases such as diabetes, COPD, heart failure, and so on. And we are also focusing on on technology for health personnel and the improvements of healthcare quality and clinical benefits and effects. We are looking very much into the next generation of electronic health patient records and how you can integrate telemedicine and eHealth in these. It's a long process. I might say that we are one of the world's largest and most experienced centers for research and development in telemedicine and eHealth. And we have a quite interdisciplinary approach and aim to shape eHealth for the future. We are providing advanced user-oriented research. We are experienced in large-scale implementation. We are working with innovation The NST has about 100 employees working within the field of telemedicine, 44 researchers, about 40 project managers, and 10 developers. As you see in the slide, we have started in 9. Medicine since 2002 and have developed a Master of Telemedicine at the university. Since 2005 we have this master up and running. But now the real stuff. In Norway, the coordination reform was launched by the authorities in 2009. And this focused very much on integrated care. Insufficient coordination is considered the main reason that people with chronic diseases lose out in healthcare. With regards to our topic, wound treatment, coordination seems to be crucial. Wounds are complex conditions, generally caused by underlying diagnosis. And specialized units in healthcare are responsible for different interventions. Challenges occur when patients need harmonized services and also in part take care of themselves. Such contingencies need to be linked. So the Department of Dermatology at the University Hospital in North Norway has implemented a web-based wound record in order to optimize treatment and care for wound patients by facilitating interaction. This is Norway, and our university hospital. Which one can I use? No. Here is here, and the NST is here too. The university hospital has responsibility within specialist healthcare for the whole area and also Spitsbergen, the island of Spitsbergen. This is a huge area, not as huge as your Australian, but huge for us. You see in the small white map on the right side, more specific, the North Norwegian area, and the 3 arrows which point to the municipal institutions where the web-based wound record is implemented. It was established at the Department of Dermatology in North Norway and in collaboration with the NST. And now, important to mention, it is the solution was developed by the Danish Telemedicine company. It's what Knut mentioned. I'm adding to the solution he already introduced. We based our service on that. The purpose of the web-based record was to optimize treatment and care of complex and demanding wounds through self-management of home-based wound treatment. The store and forward system consists of databases, an application to communicate digital photos, and text between the users, and a tool to measure and analyze wounds. This is the picture for home care nurse, for wound nurse at the university hospital, for the patient, and the GP. All these parts have access to this web page. Patients or home care nurses take and publish digital photos of the wounds, leave comments or address questions in the web-based record to a specialist wound team consisting of specialist nurses at the hospital. And here you see the documentation. The nurses on the team have the main responsibility to reply as quickly as possible within 24 hours. The photos, comments, and responses are archived in the record for retrospective examination. The measurement tool enables an analysis of the wound's development and presents diagrams for observing changes over time. And this part here displays an overview of the existing documentation on the patient, the notes, assessments, pictures, and examinations. In total, it provides a record of the patient condition. So, 2 years after the implementation, we may say that the benefits observed are that the web-based wound record contributes to better coordination in wound care. On the hospital side, there is more rapid and more effective contact with the referred patient. On the home care service side, they give advice, guidance, and an adequate follow-up of the patient. And the patient also is able to adequate follow up the wound treatment and even to avoid unnecessary travel to the hospitals. Although it's not 5,000 miles, it may be 40 and up to 100. But on the other side, we also have experienced a gap between user satisfaction, which is high, and the low degree of diffusion. And our assumptions are we have experienced technology refusion among the staff in the home care service. We've also seen that there is a lack of institutionalization of the service in home care. It's not part of the daily routine. It's what Mr. Single called mainstream. We need mainstream. And the diffusion of the service is not part of the management's hospital strategy. This is also an important aspect. What we mean causes low degree of diffusion. So we're working on publications. We have been investigating the impact of the wound record on self-management of the patient. There are several aspects which are highlighted by patients using the record, like autonomy, flexibility of the service, like experience of safety and trust, like being involved, the patient, like the feeling of control is mentioned, and of course motivation and the emotional experience of hope. So these are aspects which will be published on. Further, there will be a publication on an explorative study to highlight why a few home care nurses out of many who were introduced to the service became users, and what was enacted in terms of processes of change and improvement. And here are some links that may be useful for you if you want to know more about the service. You can also contact me whenever you want. Thank you.
Thank you, Undine, for this very nice presentation. It's always nice to see when you can collaborate in the Nordic countries. I would say Norway is kind of Denmark stretched out 10 times or so telehealthcare is really an option in Norway. I would like you to go into the discussion on patient empowerment. You shortly mentioned that patients do not always take telecare to their hearts, but do you have an idea of, are we working with people who want face-to-face consultations, or do you think it's just a matter of dissemination and people would adhere to it in due time? You think we can empower the patients to use the technology in a sufficient level?
I think the patient is not the problem, but because patients are the ones who experience high satisfaction with this service. So it's more, it would be more a work we have to do on the staff side, because the technology refusal is of course within a very active working day. This is an additional thing you have to deal with, the technology part. And of course, before you have mentioned education as a very important point here. So I think there, the work has to be done there, mainly.
Okay, I could ask you the same question as I put to Donna. Has this created more contacts? I mean, in Norway, I believe the concentration of hospitals is in the southern part around Oslo. Of course, you had Tromsø, you had Trondheim, and so on, but you don't have close-lying hospitals everywhere in Norway. So do you have a feeling that the contacts, the telecontacts, are very high in comparison to what you do with usual care? You have a number of nurses that wants to contact you several times a day for specialist service or what?
I think again, if I have understood you well, whether there are more, they are trying to contact more the university hospital, for example, in order to get advice. And I would say this has to be observed over time. It's not fair to say, yes, there is more contact. This is more a faux thing, I believe, because in the beginning, when you introduce a service, there has to be more contact. There has to be a real good they have to work really close together until the people feel secure, the staff feels secure. Afterwards, I would say that the transfer of competence between specialists and nurses will become a case, and this would reduce maybe the need of contact.
Okay, so what you're saying is that we have to create a team spirit from the beginning and see what. Questions?
Good morning. If I might just ask the whole panel, I'm Terry Swanson from Australia. I live in a rural area in the same state as Bill and Victoria. Several years ago when I tried to introduce consultations, I have my average patient is 75, and they do travel on average about 45 minutes, but they prefer to come physically to the clinic, and I think some of it has to do with the social contact, that sometimes a family member will come to their town, take them to the consultation, then they'll go have lunch, and then they take them back. Is that maybe a barrier that others may be seeing?
Shall I start to answer?
Yeah.
Within another condition, the nephrological diseases where people have to get dialysis quite often, we have found out that people feel that the hospital where they get this dialysis is their second home. So the contact is very important. And of course, you are often alone with your disease, especially that type of disease or others, very alone. So whom can you share your thoughts and your anxiousness with the disease? At the same time, we see that nephrological organizations see a lot of potential with telecare, because what we have seen in our projects is that there is more continuously follow-up. Because if you have to travel to the hospital, then you get an appointment, and then at that time, so you can't get something in between. But if you can arrange something within telecare, it's more flexible, the system. So that would be my answer.
I think our experience in the UK was that quite the opposite, actually. We did a small study in nursing homes, and of course to get patients to an appointment, it involves disturbing their life, putting them in an ambulance, maybe confuses the patient, and the transportation and the resources that are put into transporting a patient to an appointment is quite significant. So I suppose
I think it's the same with the aged care, but
Yeah.
it's mostly people still living in a home environment.
Yeah.
So they don't have that interaction
Yeah.
with healthcare
Yeah,
professionals.
no, and maybe we need a joint approach. There was another question at the back there. I think we perhaps should take that.
Thank you for a very interesting presentation. I'm from Denmark. I'm working with the same system as you are. I'm from the hospital, and we have a challenge when the patient is brought to the hospital and to acute ward, then the personnel in this ward doesn't have access to the data from this system. How do you manage that in Norway?
Good question. In detail, I can't answer you, but I will find the answer for you. So come in contact with me.